Senator Carter.
Here.
Senator Moon. Senator Nirenberg.
Here.
Senator Lewis.
Present.
Senator Nicola.
Here.
Senator Hudson.
Here.
We've established a quorum, and we will now begin our hearing. We will begin with Senate Bill 26 with Senator Moon. Senator, please proceed with an introduction of your bill when you're ready.
Good morning. I'm Mike Moon. I represent the Missouri 29th Senatorial District, and I'm here to present Senate Bill 26. The primary premise of the bill is to remove a sunset that was placed on Senate Bill 49 2 years ago. And about that same time, there was a report that emerged from St. Louis involving allegations that an individual employed at Washington University in the medical clinic, and this particular individual, Jamie Reed, is here, I believe, today to offer some testimony. So I'm going to give her the majority of the time. And so I just want to make a few points, though. Senate Bill 26 is more than just a simple repeal of the Sunset on the SAFE Act. It also includes definitions for reproductive health care. With the recent passage of Amendment 3, there have been attempts to classify gender transition procedures as reproductive health care. And also in 26 it states, as used in the laws and regulations of this state, unless clearly and specifically stated otherwise, the term reproductive health care shall not be construed to include gender transition surgeries or the use of cross-sex hormones or puberty-blocking drugs for the purpose of gender transition. This definition is crucial because if there's an attempt to challenge the SAFE Act by arguing that gender transition procedures fall under the protection of reproductive health care, the courts will first refer to the constitutional definitions. And there's no constitutional definition of reproductive health care in existence today, so the courts will likely rely on the statutes to determine its meaning. So if there are questions, I'd be happy to answer them, but I would also like to defer my time again to Jamie Reed.
Any questions for the senator? Seeing none, we will proceed. Can I get a raise of hands for those who are testifying in favor of Senate Bill 26? Can I get a raise of the hands for those here to testify against? Okay, so we're going to split the time. It's about 50-50, so we're going to split the time 15 minutes for both those in favor and those against. So can you keep that time? Okay. And if you're here to testify for multiple bills, we just ask that you keep your voice testimony for one bill. And the witness form's up here to testify in favor of all of the bills are up here. Just do that with a witness form and testify again by a voice witness for one. Yes.
Madam Chair, if I may, just when I saw the show of hands, I thought it was about 2 to 1 in terms of opposition and in favor. So if we could just do a show of hands, if it is 50-50 to keep it the same. But I saw a lot more hands in opposition than in favor.
Even if we're going to keep it about 15 minutes on both sides, so if we do those in favor of 4, we're automatically going to go to those against. So they should get that time anyway. Does that make sense? Okay,
and then an ask I guess I would have is folks who aren't able to testify, we run out of time, is that if they submit written testimony that it is submitted to all members of the committee.
Yes.
As folks have traveled really far to be here for this today.
Of course, yeah.
Thank
We'd love to have this go on further, but we have there's a hearing after this, so we have a really short time for the room, so that's why we're having to limit testimony at all. So happy to do that though, of course. So, all right. We'll begin with our first witness in favor. Except for her.
Good morning. My name is Jamie Reed, and I hold a Master's of Science in Clinical Research. I am a lesbian, a Democrat, and the whistleblower from the Pediatric Gender Center in St. Louis, Missouri. So much of what you will hear today will involve perspective. One perspective is that the sunset should be removed and the restrictions allowed to continue. One perspective is that the sunset should be allowed to go into effect and these interventions allowed to restart in our state. How did we get to this point where so many people have such a different view? Some people testifying today are firmly on a train that I'm going to refer to as the trans train. They believe that this train is moving towards a beautiful future of utopian views of affirmation. Others of us have been standing alongside the train tracks seeing this go by. Very few of us have once been on this train and have been able to get off. I'm one of those people. Part of what the problem is that everyone on this train just sees this blur of us alongside the tracks, and they think that we are protesting them, thinking that our signs are saying hateful things and that we are screaming angrily at them. What we are truly doing is holding up signs saying that we care about you, we love you, we want you to be healthy and whole. And we are truly doing what we are trying to do is show you that there is research evidence to prove that this should not be a treatment given to children. We are not screaming out hatred. We are not screaming out anything but a warning to try to get you off of this train before it crashes. Please realize if you still are on this train, you are in a silo. The only information that is able to be gotten through is information that is highly controlled by the conductors, requiring you to stay on this train because their livelihoods and their paychecks require you to stay in your seats. Some of the parents you will hear today guided their own children onto this train and are terrified and see no way but to stay seated. We are screaming into this train. We are begging for those of you to trust us that if you jump, we will catch you. There were 3 distinctive pathways that I took to recognize this train was headed for destruction. The first one came when I realized that I would never bring my own children to the clinic for which I worked. That is a huge problem. I am a mom of 5 children. I did not trust the institution to care for my own children, and you should not trust these institutions either. First of all, there was an intense internal debate going on. Dr. Sarah Garwood, our adolescent medicine physician, believed that we were treating a mental health condition called gender dysphoria. She believed that it was a condition that could be adequately diagnosed and could be successfully treated through physical disruptions of the body. Dr. Chris Lewis, the co-director, did not share this view. He believed that we were treating an internal, authentic trans self that children could magically identify on their own. He believed that there was no need for a diagnosis of gender dysphoria, that there was no need for distress, and simply children could make this announcement one day on their own and that we should all believe them. What we now know is that Dr. Annalou DeVries, one of the creators of this concept, has now come to understand that there is no good medical evidence to support this gender dysphoria model. She now believes that children should simply have the right to change their physical bodies and that they should also have the right to experience profound adult regret. I simply do not believe that any state should support medicine that is about irreversibly changing children's bodies simply because they say that they want to. The second reason that I no longer trusted the center where I worked is because we were seeing detransitioning children. I struggle to explain to you how profound a detransition is, the impact that is rarely discussed and what testosterone can do to a human body. I was part of giving hundreds of young women testosterone as young as 13. I knew that the impact of testosterone on their bodies was going to be profound. But one thing that I didn't realize was that it also was going to forever impact their human voice. I now know so many detransitioners, and as soon as they speak, I can hear the pain in their voice that I have caused. But it's like being on that train. Some people who are on this train believe that they sound like a convincing male's voice. And now, all that I hear, now that I'm off of the train, is the vocal cords have been destroyed and unnatural pain. Sometimes our voice is the only power that we have. And to know that there are hundreds of young women now whose voices I have irreversibly destroyed is devastating. Those girls were the second reason I knew I had to get off the train. And the final element that allowed me to jump were the boys. This was the reason why this all began. It was this idea that we could somehow turn a boy into a girl and somehow turn a man into a woman. It is so presumptuous to believe that any of us would ever have this power. I saw boys who reached us in time to get their puberty blocked and then feminizing hormones. We used these powerful drugs to the point where their external appearance could be incredibly convincing. But what I heard from these patients in the privacy of that clinical space is that their internal disconnect was profound. We had taken children and told them a lie that they could become the other sex, and as they matured into adulthood, they came to the realization that they could never be a woman. Can you imagine being lied to by your parents, by your doctors, and all of these institutions around you about something so incredibly profound? They were not getting better. We could make them look the part, but we can never rectify or solve that internal sense of self. And you will see so many people here today make huge announcements about how this has saved their life. I can tell you from being on the inside that most of them in private will sometimes say only to their physicians or caseworkers like me that this is not a panacea and that they still hurt. Some of these parents will tell our local news that everything is wonderful and great, but what I can tell you from being on the inside is that they came to realize that they had lied to their children and that there is a reality that we can never change our sex. Sometimes the most courageous thing that we can do is tell people, I'm sorry. I'm sorry that I participated in this. I'm sorry that I guided so many of you onto that train. I'm sorry for all the hurt that I have caused. But I'm proud as a Missourian to know that we have stopped this hurt. But I'm very sorry that there are still conductors in this room seeking to guide more children onto this train. I'm sorry that Promo still exists as an advocacy group, that it's still taking money from gays and lesbians. It should have closed its doors after Oberfeld. I'm sorry that Promo's leadership is in this room today, hurting people, hurting families, and continuing to lie. I'm sorry that my political party is still on this train. I'm sorry that NPR is still on this train and the New York Times. I'm sorry. We are going to continue to have more and more people line up along the side of this train and tell the people on it that we are here to catch you if you're ready to jump. I am here to tell everyone that there is nothing that any young person needs to change about their bodies, that they are perfect the way that they are. I jumped off that train 2 years ago, February 9th of 2023. I published my story in the Free Press, and not only did people, like those sitting amongst you, catch me, but one of the most important things that I've seen in this state is your Attorney General stood up, accepted my documents, did an investigation, and found what I said to be credible and true. Our state is the first state in this nation to have its SAFE Act upheld in a preliminary injunction. It is the first state in this nation to have a full trial on this evidence, and our state found the SAFE Act should stand. The safeguarding in the SAFE Act is one of the most profound pieces of legislation this state has ever put forward, and I beg you today to make sure that the sunset is removed. We in Missouri have been leading people off of this train. I am so immensely proud of the work that we have done in a bipartisan fashion. I am immensely proud to be a Missourian and a Midwesterner, and I'm here today to fight that the SAFE Act will be allowed to continue. Thank you.
Any questions for this witness?
Regardless of what side I'm on this issue, I just want to say you are one brave woman, and thank you for your testimony.
Thank you for that.
Any other questions?
Just to clarify, are you a physician?
I hold a Master's of Science in Clinical Research Management. I run clinical research studies, and I've also worked as a case manager co-located in medical clinics for close to 20 years.
Okay, so not a physician.
Correct.
Thank you.
Any other questions for this witness? Thank you so much for your testimony here today. Appreciate it. Next, in favor.
Good morning. Good
Morning.
morning, Chairman Carter, Vice Chairman Nicola, and committee members. I am a board-certified family physician specialist with almost 30 years of clinical experience. I'm testifying in support of SB26 on behalf of the physicians, families, and individuals whom I serve as Director of the American Academy of Medical Ethics for Missouri. Missouri legislators got it right a few years ago, as Jamie had mentioned, to pass this SAFE Act. It is a common sense law that acknowledges the biological reality of two human sexes, male and female. This bill is the appropriate safeguard to stop the indoctrination of gender ideology in our vulnerable youth. I became a doctor to provide help, to provide health, and to provide hope, not harm. This bill stops the harm done by the medicalization of trans-identified children and adolescents. Unless socially affirmed, did you know that desistance is the norm by adulthood about 85% of the time? So why would we prematurely and permanently medicalize a child for a condition that usually goes away? Many who regret undergoing gender transition claim their consent lacked information on transition's known risks and available alternatives. Studies downplaying rates of regret consistently show high rates of loss to follow-up, 20 to 60%, and set unreasonably strict definitions for regret. Regret rates come from gender clinics, precisely where regretters say they avoid. Decades of studies confirm that our trans-identified children and adolescents have an overwhelming likelihood of underlying mental health problems, adverse childhood experiences or traumas, family issues, higher rates of neurodevelopmental issues like autism spectrum disorder. All of these risk factors usually predate the onset of gender incongruence and gender dysphoria. A 2021 comprehensive data review of all 3,754 trans-identified adolescents in U.S. military families over 8.5 years showed that gender hormone treatment leads to increased risk, increased use of mental health services and psychiatric medications, and increased suicidal ideation and attempt or suicide. Missouri's trans-identified children and adolescents deserve better and safer care. They and their parents, guardians deserve a physician-led multidisciplinary care team that includes intensive psychological evaluation and counseling support first, until they reach the age of maturity, which usually is somewhere between 18 to 24 years of age. We don't let them drive, we don't let them drink, we don't let them drink alcohol, so why should we do this? In those age range, they can make a truly informed consent to undergo permanent and irreversible chemical or surgical castration. The medical organizations that promote medicalization with cross-sex hormones and puberty blockers in our vulnerable children and adolescents over watchful waiting, mental health interventions, and psychological support do not represent me. In 2019, my colleague, Dr. James Cantor, discredited the American Academy of Pediatrics' seriously flawed policy on gender transition in minors. He called out the AAP's systematic exclusion and misrepresentation of entire literatures. The AAP misrepresented references that actually contradicted their transition policy. The AAP omitted advice about watchful waiting and the fact of desistance after puberty being the norm for gender dysphoria in minors. Pediatric endocrinologist and academic Dr. Paul Hrues in WashU, observes that pro-transition studies commonly share the same 6 fatal flaws. They lack randomized prospective trial design, small sample size, recruitment bias, short study duration, high subject dropout rates, and reliance on quote-unquote expert opinion. In 2017, the Endocrine Society Guidelines was the first from a medical organization to specify a disclaimer on their recommendation. It is buried in page 3,895, and it states, the guidelines cannot guarantee any specific outcome, nor do they establish a standard of care. In 2021, a British Medical Journal review gave these same guidelines a quality score of 1 out of 6, 6 being the best. In 2021, the British Medical Journal rated the World Professional Association of Transgender Health's standard of care number 7 with a quality score of 0 out of 6 because it contains no comprehensive literature review. Senate Bill 26 is a step in the right direction to promote human flourishing and protect Missouri's vulnerable youth from preventable, regret, and irreversible harm. Thank you. I welcome your questions.
Any questions for this witness? Seeing none, thank you for your time. Where are we at? Do we have any more time in favor? Okay, we're going to do one more in favor. It needs to be 2 minutes or less.
Okay, I'm going to make this as fast as possible. My name is Chris Parrott. I'm a proud Missourian. I'm also a homosexual man. And this may surprise you, but over the past few years, I've been traveling throughout this great state, fighting radical LGBTQIA+ doctrine. You may ask why a homosexual man would do this. It's because I'm specifically opposed to gender ideology, the ideology that underlies many of the things I fight against. That is the reason I'm here to support Senator Moon's SB26, which would make Missouri's ban on child sex changes permanent. As a homosexual man and a decent human, I have to oppose attempts at child sex changes. This specifically affects young people who will probably just turn out to be homosexuals like me. I know from personal experience how confusing it can be to be a young gay person. We look at the world around us and see most people behaving differently than we do. When I was an adolescent, I saw other boys starting to like girls. I didn't feel that way. When I was younger, I dressed up in girls' clothes and played with Barbie dolls. All of this did make me question what kind of boy I was and whether I should or not be a boy. When I was young, I easily could have been diagnosed with gender dysphoria. It turns out that's not uncommon for people like me. In fact, it's very easy to find studies that show the vast majority of youth that experience gender dysphoria will simply turn out to be homosexual or bisexual adults. But these attempts by the transgender movement and their supporters to change us is simply conversion therapy 2.0. Homosexuals rejected attempts at conversion when certain religious people tried to do it. We must reject this even more extreme version of conversion therapy. When a kid has gender confusion, let them grow out of it. Most do, and when they do, they'll probably just be gay. Gay people are just fine as they are. Pediatric transgender medicine, and indeed the entire transgender movement, is inherently homophobic. That's why I reject it. We don't need to be fixed, and no child, whether they turn out to be homosexual or heterosexual, is capable of making such a life-altering decision as going through a sex change. The only reason they are encouraged to do this is because of a greedy medical industry and parents who have been misguided by that greedy medical industry. It's time to end this disgusting and homophobic practice once and for all. Senator Moon, you have my full support. In the end, just leave kids alone. Thank you.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you for your time. All right, we're going to transition now to those in opposition, 15 minutes. First testimony in opposition.
Thank you, Senators, for the opportunity to give testimony today. My name is Dr. Michael Donovan, and I'm a primary care physician in St. Louis. I'm speaking today as a representative of Southampton Community Healthcare, where I've worked for the last 3 years. I trained in family medicine at St. Louis University and have been a practicing physician in St. Louis for 9 years. I am so lucky to practice family medicine because in my specialty, we're trained to treat both children and adults, the whole family. During my career, I've had the honor of taking care of hundreds of transgender patients from all walks of life, and each patient has been unique and required individualized care plans for not only gender dysphoria, but also all other health issues that we manage in primary care. I became a physician to be able to form a bond of trust with patients and to help them through some of the most difficult challenges in their lives. My trans patients are such a joy to me, and they teach me lessons in bravery and resilience. But many suffer high rates of depression and anxiety when they cannot live freely as themselves. I've personally witnessed the life-saving nature of providing gender-affirming care to trans patients, and this often includes puberty blockers and hormone medication. But the decision to use medication is a decision we come to over the course of time, caring for the patient and getting to know them and their medical conditions. We go through a process of informed consent with the patient and their parents. When I have thoroughly evaluated a patient and I know the medication is appropriate for them, and the patient tells me over time that they need it, and the parents give consent, and mental health care providers also agree, then, and only then, medicine like puberty blockers and hormone therapy are utilized and are absolutely life-saving. Notice that I did not mention surgery because we do not refer patients under 18 for surgery. I think back over the years, and many of the patients that still remind me why I became a physician are my trans patients, because I can see the dramatic improvement in their health when they have access to guideline-supported treatment. I've seen patients suffering with depression, anxiety, thoughts of harming themselves, and even the sensation of physical pain and discomfort in their body, who, after they are able to take hormone medicine, improve in all these other conditions. I had a 16-year-old patient that I think about a lot that actually had pain in his legs and had a tic disorder, like a muscle spasm. And after we were able to start hormone therapy, these things went away. He was in so much mental anguish from not being able to live his life the way he needed to, that he actually had somatic pain and spasms and wasn't able to function in school. That child is now 19 years old and thriving in college, studying theater. He has no regrets, just joy and excitement for his future. Transgender patients often will tell me about some of their earlier memories, 4 or 5 years old, when they already questioned their gender.
Thank you, sir. I'm sorry. We're quite a few seconds past a lot of time. Is there maybe one more point you would like to make?
Sure. I would just say, today I am pleading for the lives of my patients. So please listen to them, not me or any of the people you've heard from so far. Listen to the actual people who have gone through this.
Thank you very much for your testimony. I have a question, too. This phrase, gender dysphoria, I mean, I've lived a little while, and it's been fairly new, a recent term, at least for me. So I just wanted to ask you, how long has that been a diagnosis? How long has it been around?
Yeah, I think the actual diagnosis of gender dysphoria has not been around very long because historically we didn't recognize what these patients were going through.
Yeah, okay, thank you very much. Is there any questions for Senator Hudson?
Thank you, Mr. Chair. Doctor, thank you for being here. Thank you for your testimony. If I heard you correctly, you said in your testimony that you do not refer patients for surgery.
When they are under 18.
So why is that?
Because that's against the medical guidelines. So the only treatment that someone might be recommended to get, if it's appropriate, would be medication under 18.
So would it be fair to say that it's against medical guidelines to refer a child under the age of 18 for this kind of surgery because you're forever altering their body and they may not have been cognitively developed enough to where they can realize the gravity of the decision that's being made?
No, I think that the main reason that there's a distinction there is because of what puberty is, okay? So during puberty, we have changes to our body that can be permanent. And so for a child who truly does have gender dysphoria, then for us not to be able to offer them medication that could halt puberty so that they can develop a plan with their families and their medical team, that is the distinction. Surgery could be done later, it's true, and that's perfectly reasonable. But when kids go through puberty, we can't go back on that. So to miss the opportunity to give them that is the distinction.
In these drugs that you're willing to prescribe or consider for kids under the age of 18 are cross-sex hormones, if I understood you correctly.
There's 2 different kinds of medications. So there's puberty blockers, which can postpone or halt puberty temporarily or as long as they're on them. And then there are hormones that are sometimes part of a medical plan, not always.
And you don't have a problem with those hormones being administered to children under the age of 18 in certain circumstances?
Because of the benefits that they cause, that's how we do it. So there are risks with every medical treatment, and that is what we talk about ad nauseum with parents and children and the family.
So, doctor, I don't know if you've talked to some of the same people that I've talked to, but I've talked to individuals that have been exposed both to surgery and these types of drugs under the age of 18. There are individuals that will tell you that the drugs actually were harder on them than the surgeries because the drugs affected their entire body.
I have hundreds of patients that I've talked with, and I've never heard stories like that. So I've spoken to different people, I suppose.
Well, I guess we haven't been speaking to the same people.
Right.
Thank you for taking my questions. Thank you, Mr. Chair.
Any other questions? Yes.
Thank you, Mr. Chairman. Dr. Donovan, thank you for being with us this morning, and thank you for sharing your background. One of the things that struck me is when you were talking about decisions that are made, that you alone as a physician aren't making these decisions unilaterally. You spoke a little bit about that multidisciplinary team. Can you speak to a little bit, you said that typically there are some mental health professionals that are brought in as part of this decision-making process?
Yes, yeah. This is never a unilateral decision by any means. We have at least 2 mental health care providers that evaluate the patient over the course of several months to years. And if at any point any person in the family or the medical team has any qualms about this being the right plan for the patient, we don't pursue it. This is, I think, the idea that kids are being rushed through this process is really not true. You may not believe it, but I'm actually a minimalist when it comes to medication. I really much prefer to counsel my patients about other ways of treating any kind of condition, whether it be a blood pressure medicine or hormone therapy. But we have to recognize that there are kids who need this, even if it's a small group.
And the process that you laid out that you all go through is supported by which medical organizations?
So several, but I would say probably the most poignant would be the American Academy of Pediatrics. And I don't know any other issue that we don't take them as one of the paramount resources for information for kids' medical care.
Okay. May I ask, you mentioned in your opening remarks that you've practiced medicine for how many years in Missouri?
I think so. Not since
Making me do some
2018.
math here,
However
so-
many that is.
Yeah. Okay,
Yes.
so can you just share some changes that you have seen in how it's impacted your patients before the Missouri General Assembly passed the statute that we currently have in law that affects how you're able to treat and work with your patients?
Yeah. Well, I think that it puts undue burden on patients who are already in a group that is discriminated against to begin with. It makes it much harder for them to access care. And to be honest, we field communications with our patients every day that are just in terror of losing access and being persecuted for just who they are. So basically it just puts tons of burden on the clinic and the patients to be able to get them what they need.
One of the things that happened during the negotiations is that a sunset was put on these provisions so that we would have some time to unpack but truly some of the metrics in what has, how state law impacts the work of medical professionals, but most importantly, the health outcomes and well-being of those who are impacted by this law. And so if you may, I know we are short on time, but one of the things I'm really wanting to dig into is using this period of time while we have this sunset to really understand what our, again, what statute and what those consequences are for folks who are on the front line. And so if you, I appreciate your testimony. I know, again, we're short on time, but if you could help us unpack that a little bit more with any data that you have, I think I would really appreciate seeing that. And again, just hoping that it gives us pause before we proceed with anything else.
Yes, no, I'd love to provide more literature, which I can provide. And I think that is overall the best point that we can make today is this should not be a rushed decision. This is incredibly nuanced and important. And so we've spoken already about how rushed the day is because of snowstorms and other things. So there's no reason to stop this process today. We need to learn more and be able to discuss this more and hear from more people who are affected by it.
Thank you.
Senator Lewis?
Thank you. Good morning.
Morning.
Just a couple questions here. So I think something so we haven't met, so nice to see you. I'm a nurse by background, and something that I've seen, throughout my time in the building here is, just really trying to communicate that healthcare is fluid. It's always evolving. And I think sometimes I find it very frightening when we put state law and not allow you to do your job and treat your patients. It sounds like you have an extensive practice and thoroughly vet your kids. I think that, like, with this type of, with this type of treatment, it's, when we're talking about pediatrics, I mean, I just look at, like, other types of treatment, like obesity, for example. With kids, we're going to go through psychological evaluations and medications, not rush to surgery. There's just certain ways to take care of kids, and I think that, sometimes with this stuff, I think it's definitely an overreach and a disadvantage for our healthcare providers not able to treat your patients. Do you want to comment on that?
Yeah, I think that is a really important point, that this is an incredibly nuanced thing, and to make it flatly illegal does not hit the mark. We're going to miss a lot of patients that need care. A much more interesting conversation could be, how do we make more people comfortable with the idea that some people will need treatment? That would be an interesting conversation to have. How can we improve the standards of care if that's a concern for people in this panel? But to make it flatly illegal denies care to people who really need it.
Right, I agree. And I think something that I've been really concerned about is, the shortage of healthcare providers we have in the state of Missouri. The majority of counties are healthcare deserts, and laws like this, from what I'm hearing from folks back home, that our healthcare providers will leave the state because they're not able to do their jobs. And when we put these sort of restrictions on you and you have to call your attorney before treating a patient, we're just kind of shooting ourselves in the foot and further adding to the healthcare deserts here in the state.
Yeah, and I think it's just important for me to recognize that everyone in this room cares about the health of kids. We all can agree on that. I think this time would be better spent discussing the nuances of how to provide that care safely, not making things completely illegal for no one to be able to access.
Agree. Thank you so much for being here.
Thank you.
Any other questions for this witness? Senator Nicola?
Doctor, pardon me if you've already answered these. I'm just for clarity's sake. You said you've been practicing since 2018. Is that correct?
So I did my residency from 2015 to 2018. So whichever you can consider, if I was a resident, if that was considered practice or not.
Okay. And then you said you have, in answer to Senator Hudson's questions, you have talked with hundreds of these patients with gender dysphoria. So is that like your exclusive practice?
No, by no means. I take care of the full spectrum of people that live within about 2 hours of St. Louis.
Okay. And then is your practice, do you have a private practice? Do you work for a physician's group, a hospital, a university?
It's a community practice, so there's 4 physicians and 2 nurse practitioners who are like the medical providers.
Yeah.
And
Perfect. Thank you so much. Appreciate it.
Any other questions? Of course. Yeah. Senator Hudson.
Doctor, just real quickly, I want to clarify something. These kind of drugs and surgery, of course, is illegal in Missouri under the SAFE Act now. Are you referring kids to other states for these drugs?
No, I am counseling them at my office and trying to provide them just with moral support, frankly. And also, trying to get them in to see mental health care providers also for more support until we learn more.
So you're currently not doing any referrals that would be in opposition to what the SAFE Act, Missouri law currently is?
No.
Thank you. Thank you, Madam Chair.
Any other questions? Seeing none, thank you for your testimony.
Thank you.
Make sure you leave your witness forms.
Oh, yeah.
Thank you. We'll take one more person in opposition to Senate Bill 26.
Good morning, y'all. My name is Kat Rose. I am a real, live transgender person, and I came here from St. Louis to tell you why we all, independent of party or ideology, should oppose Senate Bills 26 and 75. Hormone replacement therapy, referred to in these bills as cross-sex hormones, is the single greatest medical treatment I have ever received. I am a woman immutably and unchangeably, and living with the correct sex hormone, estrogen, as my dominant sex hormone, has allowed my mind and body to develop in ways that have finally allowed me to be me. Since starting HRT, I have become more confident, I am so much happier with my body, and where before even the happiest moments of my life were tinged with a bitter aftertaste, now even the saddest and most painful moments of my life have a hint of sweetness and hope. I have become someone who supports her community, who inspires others to do the same. I have become someone I am proud to be in my entirety. Estrogen itself didn't make these changes happen. I did. Estrogen simply freed me of living in the wrong body and with the wrong hormone. The rest was what I did with that freedom. My only regret regarding gender-affirming healthcare is that I couldn't start it earlier to escape a testosterone-based puberty and the often irreversible changes that come with it. Before estrogen was ever prescribed to trans people, it was prescribed to menopausal women and to other women with low levels of endogenous estrogen, a group which, I will note, includes trans women. Our healthcare is your healthcare. Every medication trans people receive is also prescribed to cisgender people. It is the job of trained medical professionals, not legislators, to evaluate whether these treatments are safe and effective. And every major medical and mental health association supports their use as the only effective treatment for gender dysphoria. Allow Missouri transgender youth and their families the freedom to seek out this life-saving care. No matter your party or caucus, every one of you should see how this legislative overreach threatens all of our freedoms and sets a dangerous precedent of government power. Don't tread on me, and don't tread on Missouri's trans youth. Vote these bills down.
Thank you for your testimony. Any questions for the witness? Senator.
I want to thank you so much for your testimony, but can you tell me, maybe you said this, how old were you when you started HRT?
When I started HRT, I was 24.
Okay. Thank you very much. Appreciate it.
So do you understand that this is for minors only?
Yes, and I addressed that in my statement that my only regret regarding gender-affirming care is that I could not start it earlier due to, as several people have mentioned, the often irreversible consequences of it.
So you haven't had to experience what it feels like to begin that at an earlier age and then decide later that you don't want to do that?
Thank you so much for the question. I would say that I have the experience of watching my body change irreversibly in ways that were incorrect, seeing my body endure changes from testosterone and having to live with the knowledge that I would have to deal with those changes for the rest of my life.
Thank you for your comments. Any other questions?
Thank you, Madam Chair. I just want to thank you for being here, for your bravery. I don't know if there's any other topic that we discuss that puts people and all of their existence just right out there at the witness stand. And I am so grateful for you all. And I also want to say I'm so grateful for promo. I'm somebody who didn't know a lot about things when I got into the legislature, recognizing that we're making laws, that I really have to understand the impact. And some comments were made about an organization today, and I just want to thank promo, all the allies and advocates that continue to come here year after year to share your stories and share just a little bit of your humanity with us. And I appreciate your bravery and strength.
Thank you. We appreciate you too.
Okay. Oh, sorry, Senator Lewis.
Thank you. I just want to point out what you said about don't tread on me. I think that's really important because it's like, in your circumstances, and I also want to just mention that, I think a lot of folks in this room believe in life, liberty, and the pursuit of happiness. And is that for all, or is it only for a certain type of person? So thank you for being here.
Thank you.
With no more questions, Senator Moon, do you have any other comments you want to add? Okay. Are there any questions for the senator before we move on? All right. Thank you. With that, with no more questions for the senator, we will now move to Senate Bill 7. No, we'll do that afterwards. I mean, make sure that you're turning your witness forms, and if you were here specifically to talk about Senate Bill 26, make sure you turn in those comments and witness forms. We will make sure those are distributed to the rest of the committee. And if there is time toward the end we will open it up for more testimony, but just trying to keep it in our time limits. We're limited on time and how many witnesses we can have right now. So with that, we're going to move to Senate Bill 75 with Senator Hudson. Begin when you're ready, Senator.
Thank you, Madam Chair. Members of the committee, for the record, Senator Brad Hudson, representing Missouri's 33rd Senatorial District, here to present to you Senate Bill 75. Senate Bill 75 and bills like it are bills that are meant to protect children. It's a bill to safeguard their innocence and a bill to secure their future. This bill repeals the sunset on the Save Adolescents from Experimentation, or SAFE Act, and it also eliminates the grandfather clause. I was proud to be one of the authors of the SAFE Act in 2023. I was a state representative at the time. I was proud to be the individual that was able to stand up on the House floor and make the motion that we send that bill to the governor, and I was proud that the governor signed it into law. This bill is now the law of the land in Missouri. It's protecting children from transgender drugs and surgeries. The sunset that was attached to it on the Senate side only applied to the drugs portion of the bill. This legislation that I have would remove that sunset. The sunset may have been added in the Senate as a way to get the bill passed, but if it's good enough to protect kids today, it should be good enough to protect kids 2 years from now, 10 years from now, and forever. Children should not be subject to sex change drugs and surgeries, period. The children of our state are our greatest asset for the future and should be protected. Let's be very clear here today, in case anyone doesn't understand, which I think most, if not all of us do. The SAFE Act is now law. It is now illegal in Missouri for kids to be subjected to sex change drugs and surgeries. The SAFE Act has been upheld in court on more than one occasion. This bill simply removes the sunset and the grandfather clause, things that should have never been there in the first place. I would appreciate your help as we work to keep children safe from experimentation and exploitation. I object to the term gender-affirming care. I believe if we wanted to affirm these kids, we would not tell them they were born in the wrong bodies. Please work with me to make this law permanent, and I'm happy to take any questions.
Thank you, Senator. Any questions for the witness? For the senator, not the witness. Thank you. Seeing none, we will move to public testimony. Those in favor, please come forward. We're going to keep in order to have more testimony, we're going to keep the comments to 2 minutes or less. That way, hopefully, we'll be able to get through more. So with that, we'll listen to our first testimony in favor. So start timing, 2 minutes.
Thank you, Madam Chairwoman. My name is Arnie C. A.C. Dino, State Public Advocate. I submitted my testimony this morning online for all three bills. I'm in support of all three bills, removing the expiration of the law from the state statute. I believe in protecting the children of our state, all across the state. I believe the children need to remain as children and the sex that they were born as. When you're 18, you can make your own decisions and pay for your own expenses. But I believe that we have an obligation in Senate Bill 26, Senate Bill 75, and Senate Bill 76 to protect children and to ensure their safety. And for those reasons, I'm in full support of this bill. Thank you, Madam Chairwoman.
Any questions for the witness? Seeing none, thank you.
Thank you.
Next in favor?
Good morning, Madam Chair. For the record, James Harris representing Do No Harm Action, here to testify in support of Senate Bill 75. We were supportive of the effort 2 years ago. That's been debated by this legislature, and it is the law. Removing the sunset makes sense. And I would like to thank the sponsor or the witness on the last bill about how brave it was when she stepped forward. If you have not read her affidavit from 2 years ago, I read every word. Read it. You'll go, how could a research medical institution be this willy-nilly on stuff? And it was so disturbing. And she's been attacked personally, professionally, and what she said has been proven correct. And with that, I'm happy to answer any questions.
I have a question. Are you also in favor of Senate Bill 26?
Yes, Senator.
Okay, thank you for that clarity. Any questions for this witness? Seeing none, thank you. Next in favor?
Good morning, again, Madam Chair. I won't reiterate my prior testimony, just here to reiterate that I'm in support also of the Senate Bill 75 on behalf of the Missouri American Academy of Medical Ethics. Thank you.
Thank you. Any questions for this witness? Seeing none, thank you for your time. Next in favor?
Lisa Panett with Armor Vine, and we just want to go on record with support in all three of these bills and grateful to every one of the sponsors, each one. Thank you so much.
Thank you. Any questions for the witness? Seeing none, thank you. Next in favor?
My name is Timothy Faber, and I would also like to speak in favor of all three bills. In relation to the one that was just being discussed, Senate Bill 26, and the current one, Senate Bill 75, I would like to remind the committee that the Nuremberg Code requires that the subject be able to give legal consent. Thank you.
Thank you. Any questions for the witness? Thank you for your time. Next in favor?
Good morning, Madam Chair, members of the committee. I'm Dr. Guillermo Villatrueba for the Missouri Catholic Conference, representing all four Roman Catholic dioceses in the state. We would like to go on the record in support of Senate Bills 26, 75, and 76, and commend the sponsors for bringing them up for debate. The Missouri Catholic Conference supports these bills because they would ensure that minors continue to be protected from life-altering cross-sex hormones and puberty-blocking drugs that, based on a false understanding of human nature, attempt to change their sex. We are concerned that minors are not capable of giving truly informed consent to dangerous treatment that could lead to irreversible consequences, such as infertility and lifelong dependence on costly hormone therapies with significant side effects. Medical and surgical treatment for gender dysphoria denies the fundamental truth about the human person being created male and female in the image and likeness of God. As Pope Francis has stated in his encyclical letter Laudato Si, learning to accept our body, to care for it, and to respect it to its fullest meaning is an essential element of any genuine ecology. Young people struggling with gender dysphoria are loved by God and possess the same inherent dignity that all persons do. They deserve help that heals rather than harms. And using cross-sex hormones or puberty-blocking drugs for the purpose of a so-called gender transition can and will only inflict harm and cause suffering. Only when those who struggle with gender dysphoria are able to accept their bodies and their vocation as women or men will they be on the true path of freedom and happiness. So we urge you to vote do pass on these three bills, and if you have any questions for me, I'll be glad to take them.
Thank you for your testimony. Make sure you fill out a witness form and leave it there at the desk. Any questions for this witness? Seeing none, thank you for your time.
Thank you.
Next, in favor? How are we doing on time? Going once.
Hi, I'm Chris White. I'm just going on record for Liberty Link of Missouri that we're in favor of all three of these bills, and we want to thank you very much for bringing this forward. Again, I prayed for all of you this morning and for all of those who oppose this bill to really take in and have ears to hear and teachable spirits for the ones that came forward, such as Jamie Reed, and ones that were here originally in 2023 who had transition surgery and hormones. They regretted it. If they could really pay attention to that, because In 2023, senators as well as people listening left the room or mocked or laughed, and if they could really pay attention to the ones that are standing up here in support of this bill also. Thank you.
Thank you. Any questions for the witness? Seeing none, thank you for your time. Next in favor?
My name is Michael Compton, and I just want to go on the record for Act for Missouri. We support all three of these bills. Thank you.
Thank you. Make sure you leave your witness form there on the desk. Thank you for your time. Any questions for this witness? Seeing none. All right. Next in favor? Going once? Going twice? All right. With the conclusion of those in favor, we will now hear those here to testify in opposition to Senate Bill 75. Just a reminder to keep your comments 2 minutes or less.
Absolutely. Thank you so much. Thank you all for being willing to hearing from us today. My name is Ben Green. I am a resident of St. Louis, and I'm here to testify in opposition to Senate Bill 75. I am an openly transgender man. I transitioned at the age of 15, was not able to access medical care until I was 19 years old. And beneath all of that, behind all of that story, I have something in common with all of you, which is that I am an American citizen, and I am deeply concerned about government overreach, including into my doctor's office, decisions that patients are making with their parents, their doctors, their mental health care providers. When we are all in agreement about what the best individual course of treatment is for a young person, politicians should not be reaching into those offices to insist they know better, knowing none of the details about that specific young person and what their specific plan of care may be. Every single patient has unique needs and challenges, which is why there are rigorous standards created and agreed upon by every single major medical organization in the United States and many more internationally, including a recent publication of the French National Medical Consensus on Care for Trans Youth, which came out strongly in support of access to this health care when appropriate. This blatant government overreach has already had significant consequences, and data suggests over $1 billion in annual household income has been lost based on Missourians leaving their homes in pursuit of safety for themselves and their families. So I urge you to reconsider this legislation targeting a minuscule group of people and focus on issues that are actually hurting Missourians, hurting Missouri children, and vote no on SB75. Thank you.
I have a question.
Sure.
Are you familiar with this testimony of those that are in favor of the bill where their doctor has been incentivized, or the medical field has been incentivized to promote this kind of treatment? And is that a concern to you at all?
I didn't hear anything in the specific testimony before me of incentivization in terms of saying, you have to do this. That is not something that is a major concern to me. And in fact, having a constant barrage of hearings like this, of death threats to many major hospitals and healthcare providers, that is de-incentivization, right? The world is constantly telling these kids, don't be trans. It's telling these providers, you are doing something terrible. There is a constant societal pressure to say, hey, we don't want to support this, whether it's coming from a religious perspective, a conservative scoring points perspective, or something else. But I do not see a significant social pressure to say you have to provide this care.
Well, you're just saying that there's pressure on for the conservatives to do some kind of score, to have these kinds of conversations, and I'll just speak for myself. But when you see the statistics that kids on the autism spectrum are especially susceptible to this kind of ideology, when you see that doctors are incentivized, when you hear from parents that they were told that the blood of their children would be on their hands if they didn't go forward with this kind of medical malpractice is what I'm going to call it, it is a concern. So it's not to say that we're here trying to score socially or anything else, but we are trying to insert ourselves into the conversation to say, when it comes to minors, are we doing the right thing? When you see that in Europe, they have reversed these kinds of procedures.
In certain countries.
It's still legitimate, is it not? It's a concern. And so to have this kind of public dialogue is the reason why we do exist and why we are here. I'm grateful for your testimony. Are there any questions for this witness?
So again, I want to preface this by saying I recognize we're asking questions that you wouldn't normally have to answer, and so don't feel like you need to, or if you can pass it off. But one of the things that I've learned from the previous witness as a provider, the process that is gone through for this. So you shared that you chose, or you were able to transition as an adult, but you started seeking care when you were younger?
Yeah, so I realized that I was transgender when I was around 15 was when I finally got access to the language to describe that experience. And I was looking for that care, and because of parental support, was not able to access that until I was much older. And that period of my life in which I knew what I needed and wasn't able to access it was, I was a bystander in my own life. I did not hug my friends. I showered with the lights off. I was really pretty tremendously miserable, knowing that I was just waiting for the moment when I was going to get to start living, which was when I was able to access that gender-affirming care.
So you weren't targeted or marketed, or somebody said,
No,
hey,
I was
come
constantly
buy my
getting
products to...
bullying, or doctors saying, no, you don't want to do that, or just like a lot of people who were telling me, hey, this is a bad thing. It's a dirty word to be transgender. I was treated relatively cruelly by a lot of the people around me, or with people who just, weren't interested in learning more and were frightened of the different way that I was living my life. And so I was not facing any pressures to transition. Nobody was saying, hey, you should go on this thing. I was saying, hey, I think I'd be a lot less miserable if I had access to this medicine, this well-researched health care, but I was not able to access that care. But nobody was pushing me down that path.
Okay, thank you for clarifying that.
Absolutely.
Any other questions for this witness? Seeing none, thank you for your time.
Thank you.
Make sure you leave your witness form if you
Yes, I
didn't.
have.
Next, thank you. Next in opposition.
Hello, my name is Verity Tatum. My birth name is Nicholas Tatum. I'm an Iraq combat veteran, finished my basic training here at Fort Leonard Wood, Missouri in 2003. I did tour duty in 2005 as a combat engineer. I am here to oppose SB26, SB75, and SB76. My brother Daniel also served as a Marine and passed away in 2007 on Christmas Eve. He was the only member of my family at the time that knew that I was trans and bisexual. During the early aughts, our military had a policy. It was called Don't Ask, Don't Tell. Daniel and I often joked about whether or not he would turn me in. Into my parents, into the military, this was an awful joke, a bitter one, that both of us told to each other. And we'd laugh, a bit of gallows humor. I would have been removed from the military. I would have lost my family. When he passed away, I lost the brother that had known me almost every single year of my life. After his death in 2007, I became an American Gold Star sibling. My family became an American Gold Star family. An American Gold Star family member sits on the Veterans Affairs Committee in Washington, D.C. Imagine serving a country faithfully for a few years of your life and putting yourself in dangerous situations, searching for explosive devices, all while signing a blank check for the nation, with the hope that one day you, a trans citizen, will transition and finally feel relief for the first time in decades, or that your trans child will be able to transition because now you're in the military and you can get that good, sweet VA health care, and they'll be able to go in and get the hormones that they need in order to transition. I am shocked that Moon, someone that would sit on the Veterans Affairs Committee, the Military Affairs Committee here in Missouri, would push forward this kind of care.
Your time limit is up. Can you wrap up your comments? Thank you. Thank you. Any questions for the witness?
Thank you for your service to our nation, and I thank all the Gold Stars families for the sacrifice. One comment that my colleague said earlier was recognizing what you all fight for our liberties and for our continued freedoms. And when we talk about making sure that every individual can continue to pursue life, liberty, and pursuit of happiness, how does this bill, I know this is a tough question, but how does this bill impact the ability for individuals to be able to seek that?
Oh, it heavily impacts us. There are 15,500 transgender military members currently serving, right? And if you're in the VA system like I am, there are 134,300 trans veterans today. 21% of transgender people have served our country in this capacity. 21. That's excuse me, hell of a number, all right? It's extremely patriotic, and I love it.
Yeah, thank you for sharing your story. I really appreciate it.
Any other questions for the witness? Seeing none, thank you. Make sure you leave your witness form there on the desk. Next, in opposition.
Good morning. I am Amy Hammerman. I am a volunteer with National Council of Jewish Women, and I am a parent in Missouri. I don't have trans children. I have 2 cisgendered, heterosexual teenage boys, so also please pray for me. But I'm speaking as a parent because there's been a lot of talk about children not really being able to consent to this health care. And I will say that as a parent, we are charged with not just the legal responsibility, but the moral and ethical responsibility to give consent on behalf of our children. Parents across this country consent to medical procedures for their children that are inherently dangerous. They may be experimental. They may cause irreversible effects. I can think of a friend of mine who had to consent to experimental treatment for cancer for her child, and that child may well never be able to give birth to her own children someday. But those are the very difficult decisions that we make as parents. I see in this bill the worst kind of nanny state I can imagine as a parent, where, with due respect, this body is coming between me and my child's medical practitioners, my family, my clergy, in making decisions for our children. And I plead with you to reconsider this intrusive governmental overreach into the decisions made by parents. We have differences of opinion on everything from experimental treatments to vaccinations, and yes, gender-affirming care for trans children. And I urge you to vote no on moving this bill out of committee.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you for your time. Next, in opposition.
I'm David Lee Brush with the Missouri Equity Education Partnership, and we are opposed to all 3 of these bills. I'm going to let medical experts and people with lived experience talk about what it means for them as transgender people and transgender caregivers. Our organization's position is that parents, patients, and providers are the people that should be making health care decisions for people in Missouri, not politicians. And furthermore, we are concerned that less than 2 years after the sunset was voted in and the grandfather clause was voted in, we're seeking now to eliminate it. It seems like the negotiations that were done were not done in good faith, and we are asking the Senate to stand by its collective word that these sunsets would remain in place. No matter why you chose to vote for it, you voted for the sunset. And so how can organizations come to you and talk to you and try to talk to you with good faith, knowing that you'll say anything to get it passed, and you'll vote for anything to get it out there, and then you'll change your minds? That's our concern, is that we're just asking you to stand by your collective word. Thank you so much.
Any questions for the witness? Senator Moon?
Good morning.
Good morning.
Were you in the negotiations for the 2 bills?
I was not. I was around in the building for the 2 bills, and I was talking to people who were part of the negotiations, and I know the sunset was put on there to get the bill moving and get it moving forward, and also to be able to do research and to figure out if it was going to do harm. I think, spoiler alert, it is, but also to find out more information in the 4 years' time that we would have the sunset. And if we cut it short, we'll never know.
You mentioned an agreement. What was that agreement?
Well, I mean, I'm just saying that the sunset was put in there. It felt like there was an agreement put into place, and everybody was like, we don't want the agreement, but we want the bill to move forward. So that seemed like compromise, which is what politics is about. But if people aren't going to stand by that compromise, then it seems like it diminishes the integrity of the body as a whole.
You say you felt like there was an agreement. There was no agreement.
Senator Moon, can you talk
I'm sorry,
closer
yes,
to the
please.
microphone? It's
I
hard to
can't hear you. Thank you.
Excuse me. Should I repeat everything I mentioned?
Please, just the last question.
Well, first I asked about the agreement. There was no agreement, and the agreement was to have the parts of the bill that remained today and the sunset. The first year after this bill was passed, Senate Bill 49, I should say, you can look back in the records, legislation was filed to remove the sunset, and not a peep came out of anybody opposed to it at that time. Of course, it didn't make it to where we removed the sunset, but now where we have momentum, where the sunset is likely to be removed, people are coming out saying that an agreement has been broken, that agreement was not in place, that we would leave this for 4 years. There was no agreement broken, so I hope that you'll go back to your sources and correct them, because there was no agreement to leave this in.
Well, my understanding by reading the legislation in the bill is the sunset was put in place, and also if it came up a year later, there weren't public hearings for us to be able to come and talk about it, I don't think, last year, because I would have been here. So this is our first opportunity to be able to come and say, hey, don't remove the sunset that was put into place, that's written in statute now. But thank you so much. I will, and I should have clarified that my understanding was that this was put in place. Thank you.
Senator Lewis.
Thank you for being here. Wanted to echo one of your comments. So one of my favorite things is knocking doors and getting to know my constituents. And what I heard time and time again is that healthcare decisions are personal, private decisions that should be up to the individual and their healthcare provider. Heard that a lot this summer, and so thank you for bringing that up. And then also, I find it interesting that oftentimes, we say parents know best in some instances, but not other instances. And you brought up a good a situation with like vaccines, do they know best in those instances, but maybe not when it comes to transgender care. So
yeah, it seems like in Missouri, parents have rights until we don't want them to have rights.
Yes. Yeah.
Thank you.
Thank you.
Are parents responsible for the upbringing of their children?
Yes.
What happens if you expose your kids to drugs or marijuana or other things that may have a detriment to them and they're minors?
Well, those aren't medical procedures, so
No, but it's
we would be. I mean, as a mandated reporter, I would have to report, but they're not medical procedures.
I think I'm just going to make a comment. This is why we're having this discussion, because if there is harm being done, it's worth the public discussion, is it not?
It is a public discussion that has provider input that says it's not as harmful as we think it is.
Thank you.
Thank you.
Senator Nicola.
Ma'am, thank you for your testimony. I just want to make clear that today is my 5th week anniversary of being in the Senate, so I was not here.
Congratulations.
Thank you very much.
Thank you.
All right, thank you. No more questions for this witness. I appreciate your testimony.
Thank you so much.
Make sure you leave a witness form on the desk. Next, in opposition, are we? Okay, this will be the last one. Thank you.
Members of Congress, hi, my name is Taylor. I'm a transgender woman, and I'm here today from Wentzville, Missouri. I stand before you, or sit, as a parent of 5 wonderful children. I've been blessed with these children and have the privilege to see them grow up happy and healthy lives so far without overreach of the government. My oldest son currently serves in the U.S. Army. We are very proud of him. I would like to say that government overreach is something that nobody here wants. We've gone over this topic many times. And I'm hoping that by being able to speak here today, that I will prevent government overreach into our children's lives and making healthcare decisions based upon information provided by ideologies that are not medically driven. So I think we can also all agree that none of us wish our children to have any medical intervention required in their lives. Sadly, one of my children has not been so lucky and has been diagnosed with a disorder that impacts less than 1% of our population. At this time, I am very grateful that he is able to receive medical care, but I am very concerned that care such as this will be made illegal by government based upon religious or ideologies that are not based in the medical field. So I'm wondering, why are politicians making medical decisions for our children? Why is that not left to the doctors and the parents who are supposed to be the caregivers of these children? So I challenge you today to look in the mirror and ask yourself, whose side are you on? Are you on the side of freedom, or are you on a different side? Thank you for your time.
Thank you. Any questions for the witness? Senator Lewis?
I know you ran out of time. Did you have anything else you wanted to say, or did you get everything?
Just that as a transgender woman, I wish I would have had access to these drugs and treatments when I first said I was trans, which was in 5th grade.
Okay, and then I just want to, we work here, we're here every day, and I know it's kind of, it's really challenging to come before us and tell your personal stories, especially talking about your children. So thank you for being here and being brave to come
Thank you.
in front of us.
Any other questions for the witness? Seeing none, thank you for your time.
Thanks again.
With that concludes testimony in favor and in opposition to Senate Bill 75. We're going to move on. Any closing comments, Senator Hudson?
Just real quickly, Madam Chair, and you touched on this, smoking cigarettes, purchasing alcohol, gambling, sexual activity. There are some substances and activities that we all understand that children do not need to be exposed to. That's not government overreach, that's decency, and that's protecting kids. Thank you for the time.
Thank you. All right, that concludes our hearing for Senate Bill 75. At this time, we will have Senator Schnelting come forward with Senate Bill 76. Senator, begin when you're ready. Please leave your witness forms on the front desk if you are leaving, and we will make sure that those get dispersed among the committee members. Senator, when you're ready, please proceed.
Thank you, Madam Chair, members of the committee. Senator Adam Schnelting, representing the 23rd Senatorial District. That's Eastern St. Charles County, for those who may be unaware. Today I want to present to you Senate Bill 76. It is an update to the Missouri Human Rights Act. The intent is to clarify what is meant by sex when the statute was originally written and passed. In RMA versus Blue Springs School District, the courts recently sided with a transgender student who sued the school district over their single-sex bathroom policy, awarding the student about $4.7 million. The state Supreme Court issued an opinion in which they essentially redefined sex to include gender identity, which strayed obviously from the more traditional interpretation of sex. When the courts set that precedent, it made it challenging for some of our school districts to set single-sex bathroom policies. Public schools, like one of my own in my own district, have sought to pass policies that ensure stricter guidelines for their non-single stall restrooms in an effort to protect kids from those who would use the loophole as a backdoor to prey on kids. But with the court's precedent that has been set, our districts are fighting a losing battle. They're facing potential fines and lawsuits. What this bill does, what it aims to do, is update and clarify that the original intent, that is, that the term sex that was placed in statute in the human rights statute relates to biological sex and does not include gender identity or sexual orientation. And I think that this will solve part of the problem that we're having with districts who are concerned about passing single-sex bathroom policies. And this would leave it up to the school districts, so there's no confusion. Each of the districts would be able to pass their own policies one way or another. This would just bring some, reduce the ambiguity in our state law and bring some clarity and a stable legal definition of sex in the Missouri Human Rights Act. With that, Madam Chair, I'll open it up. I want to be very brief. I have a hard deadline at noon to be at another meeting, and so I want to make sure that everybody who's here to testify for or against can get that opportunity.
Thank you. Any questions for the senator? Seeing none, we'll move forward with our first witness in favor, keeping those comments to 2 minutes or less, please.
Madam Chair, members of the committee, thank you for this opportunity to testify. My name is Steve Ellman, And personally, I'd like to testify or express my support for all three of these bills today. But I'm also here to testify as the county executive of St. Charles County, and there's two other issues in this bill and in this type of legislation. I think you probably are aware of them, but if you're not, I want to give you a little history. This whole thing about bathrooms. I was not a public servant at the time, but I remember back in the early 80s, and they were in this hall, in this room, they were debating the Equal Rights Amendment. And people on the left people on the right were claiming that if the Equal Rights Amendment passed, that there would, you'd have to have co-ed bathrooms. And of course, the people on the left said, "Oh no, that's ridiculous. No judge is ever going to interpret it that way." Well, fast forward to today, and that's exactly what our Supreme Court did back in 2019. And I will tell you, this is the Missouri Human Rights Act. As the senator suggested to you, this was based on a Missouri Human Rights Act that was last amended and passed in the Missouri Senate back in 1994. I was a member of the Senate at that time, and I voted for it. And I read the language. It said you cannot discriminate on the basis of sex. I can guarantee you it never occurred to me that in supporting that language, I would be supporting what the Supreme Court did. And I will go out on a limb a little bit. I don't think there was any of the other 33 senators or anybody on the other side of the building that really intended that language be used in this particular way. As you know, there was 4 people on the court that disagreed with me. Zell Fisher was in the minority, and he, writing for the minority, said, "It is not this court's role to question the wisdom, social desirability, or economic policy underlying a statute, as these are matters for the legislative's determination."
You've reached your 2-minute time
Pardon
limit.
me?
You've reached your 2-minute time limit. Can you wrap up your comments, please?
Okay. The other issue here that is you need to realize is that several years ago up here, you went ahead and allowed attorney's fees on this Missouri Human Rights Act. So what you have now is in this particular case, not only did the jury award damages, but they awarded a very high number on attorney's fees. What that means is when St. Charles County gets sued on the Missouri Human Rights Act, our insurance carrier is settling the case not on the basis of the merits, but on the basis of the fact that if $1 is awarded by a jury, then the winning side, then the plaintiffs gets all their attorney's fees, which is a real problem fiscally for our county and all the political subdivisions in the state. And I would love to see that issue addressed as well. If you have any questions, I'd be glad to answer them.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none, thank you.
Thank you.
Next, in favor?
Thank you, Madam Chairwoman. Arnie C. A.C. Dino, State Public Advocate. I submitted my online form in support of all 3 bills. I strongly believe that the term sex shall mean your birth sex at the time that you were brought into this world and at the time that your birth certificate was documented at the hospital. The term shall apply to all aspects, including public restrooms, public accommodations, and I feel that it needs to be a term put into our state statute. Therefore, I support SB76. It just makes sense. It makes sense morally, and it makes ethical sense. Thank you very much, Madam Chairwoman.
Thank you. Did you fill your witness form out online also?
Yes, ma'am,
Okay,
I did.
Thank you.
Did you receive it? Yes, sir. Okay, cool.
Appreciate it. Thank you for your time. Any questions for the witness? Seeing none?
Thank you.
Next, in favor?
Good morning, Madam Chairwoman and members of the committee. My name is Randy Cook. I'm a resident of Senate District 23. I'm also the Vice President of the Francis Howell School District Board of Education in St. Charles County. Although I want to be very clear that my comments here today are mine and mine alone, I do not speak on behalf of the district here today. The Missouri Human Rights Act, or MHRA, was first signed into law in 1957 to protect against discrimination based on race or national ancestry. In 1978, the law was amended to add sex among other protected classes. At that time, there was much less confusion about the definition of the word sex than there is here today. The past 10 years have seen a plethora of legal battles over this very definition, both in Missouri and nationwide. The Missouri case I am most familiar with that questions the definition of the term sex under the MHRA is RMA v. Blue Springs, which involves a school district denying a student access to the male restroom and school locker room, which the plaintiff alleges is discrimination on the basis of sex under the MHRA. In this case, the plaintiff's initial birth certificate has the female sex marker, but as a teenager, the plaintiff had the sex marker changed to male pursuant to 193.215.9 of the revised Missouri statutes. This alleged discrimination occurred 10 years ago, yet the parties are still arguing the case. The Missouri Supreme Court heard oral arguments in this case just this morning across the street, which is currently on its second appeal to that court over, in large part, the very definition of sex which your committee is hearing today. During that case's first visit to the Supreme Court in 2019, Judge Fisher, in his dissenting opinion, wrote, quote, "When there is no statutory definition, the plain and ordinary meaning of the statutory term can be derived from the dictionary," end quote. And he was referencing a 2014 Missouri case, Circuit City Stores v. Director of Revenue. Yet many Missouri courts are still confused about the definition. The courts are ignoring the dictionary and plain old common sense by concerning themselves with legal theory about the legislature in 1978, what they meant by so-called biological sex or legal sex. The General Assembly has an opportunity here to correct this, and I urge the body to vote for Senate Bill 76 and move it forward without delay.
Thank you for making your comments succinct and staying within the time limit. Any questions for this witness? Seeing none, thank you. Next in favor?
Good morning, Timothy Faber. I would like to speak in favor of this bill, first of all, because our society, our culture, and I learned this myself a few years ago, there are people who think that there is a difference between sex and gender. I was raised thinking whatever your biological sex is, that's your gender. But they create two different places on medical forms and stuff for you to fill out. So if gender is something different than sex, then why would sex mean gender? You can't have it both ways. A person's either XX or XY. In addition to all of that, I am formerly a member of the Missouri Commission on Human Rights. And I can tell you that the ambiguity in the minds of some on this issue is confusing even for people serving on the commission. And we've heard that it's already confusing for people on the courts and school districts and other employers. I believe that passing this bill will create clarity. Whether you may agree with it or not agree with it, at least there's no ambiguity or confusion on what we mean. Thank you.
Thank you. Any questions for the witness? Seeing none, I appreciate your time. Next in favor?
Good morning. Excuse me. Good morning, Senators. My name is Jane Pushkar. I am also a director and treasurer of the Francis South School Board, and I wanted to come and share my thoughts about SB 76. Though some attorneys have told us that there is already a policy on the door restricting access, and it's called boys versus girls, unfortunately, some of the language inside the MHRA puts that into doubt. It's been a long journey for Policy 2116, which is the one that I introduced in October of 2023, and the biggest problem holding it up for a second vote is the MHRA. We started hearing reports of cross-sex bathroom usage, maybe one or two, well, recently, and it has been allegedly there's a 6'5", 275-pound male with gender dysphoria going into the girls' bathrooms. Problem is that shouldn't be a problem, but for those little girls that don't want him in there, unfortunately, they're afraid to speak up for fear of retribution, fear from administration, and bullying by their peers. Their parents are also afraid of retribution. It seems that there's been certain parents whose children have been removed from let's say, cheerleading captain, whatever, after they found out that their parents were not in favor of either supporting this bathroom policy and or, other conservative values. The sad fact is that not a whole lot's being said about locker rooms. These young ladies are being treated like second-class citizens by saying that, you know what, you got to let these guys in because, they're transgender and they want to be there. There is no reason on this earth that a young male should be allowed in any female locker room for anything. And the other thing that's never talked about is this transgender bathroom usage. By not having a bathroom policy, not only are we, the problem is that males who don't even identify as transgender are allowed to go in the bathroom. This is not what society wants. This is not what society needs. And I beg you and plead with you to please pass these 3 bills that will stop some of this madness.
Thank you for your testimony. Any questions for the witness? Seeing none, make sure you fill out your witness form and leave it there on the desk, please. Next, in favor.
Hello again, Dr. Josephine Glazer, board certified in family medicine. I'm amending my testimony to include Senate Bill 76 in favor. Thank you so much for this common sense law. Thanks.
Thank you. Any questions for the witness? Thank you. Next in favor.
Madam Chair, members of the committee, Ray McCarty, President of Associated Industries in Missouri, and wanted to be in support of the bill, particularly for the 2 lines on 158 and 159 on the last page of the bill that define sex as not including sexual orientation or gender identity. We think as employers this is actually necessary because of the U.S. Supreme Court ruling that sex does include sexual orientation and gender identity. That affects employers that have more than 15 employees. By changing the Missouri Human Rights Act, you're actually changing it for those who have more than 6 and less than 15 employees. And we believe that's a very large group. We want to go on record in support of this.
Thank you.
Happy to answer any questions.
Any questions for the witness? No. Thank you for your time. Next in favor.
Good morning again, Madam Chair, members of the committee. I'm Guillermo Villatrueva for the Missouri Catholic Conference, and we would like to go on the record in support of Senate Bill 76. I will keep it short. We support this bill because it would provide a definition for the term sex that is in keeping with a proper understanding of human nature. And providing clarity in this regard will also prevent any future attempts to distort the true meaning of the law. So we urge you to vote, do pass on this bill as well. If you have any questions, I'll be glad to take them.
Any questions for the witness?
Thank
you
you
for your time. Next in favor. Going once, going twice. That concludes testimony in favor of Senate Bill 76. Those, we will go into those here to testify in opposition of Senate Bill 76. Just come forward when you're ready, and just a reminder to keep your comments 2 minutes or less.
My name is Sarah Jane Hunt. I'm the managing partner of Kennedy Hunt PC, a civil rights attorney in St. Louis. I work with clients every day who have had their lives turned upside down because of who they are and who they love. The discrimination is not just about bathrooms, it's about people. A hardworking mom whose job was made untenable because of slurs and constant taunting. A young child in an elementary school bullied for not fitting into someone else's idea of what a girl should be. A high school freshman who was beaten so badly by her classmates for being herself that she lost part of her vision. This bill, whether intentional or not, tells people of Missouri that this kind of discrimination is okay. It goes beyond disagreeing with someone's life, their way of life, and it says it's okay to hurt them, and that is unacceptable. This bill tries to redefine sex in a way that excludes sexual orientation and gender, which would effectively strip Missourians of protection against that kind of discrimination. But the problem is the United States Supreme Court already ruled in Bostock versus Clayton County that this kind of discrimination is illegal. To quote Justice Gorsuch, it's impossible to discriminate against a person for being homosexual or transgender without discriminating against that individual based on sex. Our Missouri courts have followed this opinion. There is no ambiguity. There is no confusion. This is already the law. This is the law of our land, and this bill, if passed, will not change that. But what it will do is lead to unnecessary confusion and litigation, and it will lead to a waste of the finite amount of taxpayer dollars that we have trusted to your care. At the end of the day, this isn't just about law. It's about real people, our neighbors, our coworkers, our kids, who just want to live their lives without fear of being fired, evicted, or harassed. I appreciate the opportunity to be here. Civic engagement runs deeply in my family. My grandfather, John Marvin Capps, served as elected county clerk in Stoddard County, Missouri for the better part of 2 decades. He believed in fairness, in the power of government, and in upholding democratic values. But he would be very disappointed if he were here today, and so am I. This bill is not about fairness, freedom, or what's best for Missouri. It's about making it easier to discriminate, and I refuse to believe that's who we are as a state. Thank you.
Any questions for this witness?
Just a quick question. From your thoughts in terms of how this would be a fiscal impact to possibly to the state, you obviously have been involved in many lawsuits, and what have some of those settlements been?
Well, the issue here is that even if we set aside the Blue Spring opinion that has been discussed here, sex stereotyping has always been something that was protected under the Human Rights Act. And what this bill would essentially do is if you are treated differently because you do not conform to the way someone believes a man or a woman should be, that is discrimination, and that is under sex. That has been decided over and over again. You can change this language, I've read it, it's a good effort, but it's not going to work. It does not do anything to change the opinions that have come down to say that sex is inherently a part of who you are as a person, how you express yourself, and who you love. And so what's going to happen is I'm going to still file the same lawsuits I was filing before. That is not going to stop me. I am going to take these cases all the way up to the Supreme Court, and I believe based on their own opinions, I am going to win. And then it is going to cost the state a lot of money to try to defend this. Most of the people that I have cases against, well, not most, but some are state entities. And so there's just going to be a lot of money thrown after bad. And I understand you might not agree with these opinions, but it's the law. And changing the definitions here isn't going to change anything about the way that precedent was made.
Thank you.
Any other questions for the witness? Seeing none, thank you for your time. Make sure you leave your witness form on the desk there. Thank you. Next, in opposition.
Good morning. My name is Madeline Johnson, and I am lead trial counsel in RMA versus Blue Springs School District. I came from just across the street where the case was heard by the Supreme Court again this morning. I've been doing this one case for 11 years. Changing the Missouri Human Rights Act to try to define sex, the only purpose of this definition is specifically to exclude LGBTQ plus Missouri citizens from the protections of the Missouri Human Rights Act. As an attorney, I can echo everything that Ms. Hunt just testified to. I will not be stopping to bring lawsuits. In fact, tongue-in-cheek, I kind of want to say, if this body passes this, thank you, because you're going to triple my caseload. I will be bringing lawsuits, continuing to bring them under the Missouri Human Rights Act. And then when the Missouri Commission on Human Rights denies me a notice of right to sue, I'll be counseling my clients that it's time to go to federal court and sue the state of Missouri for a violation of your constitutional rights under 42 U.S.C. 1983, for violation of a person's rights under the color of state law. It's going to be very expensive for the state of Missouri, as Ms. Hunt stated. And my resolve, I'm not about to stop doing what I do. Thank you for your time.
Any questions for this witness? Seeing none, thank you for your time. Make sure you leave your witness form there on the desk. Next, in opposition.
Good morning.
Morning.
My name is Keith Rose. I'm from St. Louis, and I am also the former director of LGBTQ initiatives at the Metro St. Louis Equal Housing and Opportunity Council. EHOC, as we call it, is a state, federal, and locally funded agency that's contracted by the government to investigate complaints on discrimination in housing and places of public accommodation. And I do have to admit, up until hearing this testimony this morning, I didn't realize how much of this bill was built around school bathrooms. And that's because seeing it from my perspective as a professional, it does so much more than that. And I really think it's important for us to talk about what this bill does. But first, I do want to say that one of the big issues that we have as an agency, EHOC, is sexual harassment. And I really, really respect that there are people who are approaching this issue because they want to protect people from sexual harassment, and we all want spaces to be safe. I know that our agency's hotline receives many calls from people who are being sexually harassed or who have been sexually assaulted, and obviously we want those people to have protections. But at the same time, what this bill does is far beyond the scope of changing the rules for school bathrooms. So there are two main components. First is talking about the definition of sex, and the second is limiting sexual orientation, gender identity from the definition of sex. So first and foremost, I want to say that we've heard a lot of talk this morning about how this bill helps clarify the definition of sex. But the reality is that's not true. This bill has a different definition of sex than already exists in Missouri statute. As a matter of fact, SB76 is different than current bill SB212 in its definition of sex and how it relies on determining someone's sex, which itself is different than SB117, which is currently being heard, which also has a different definition of sex, which is also different than SB632, which is different than SJR57, which is different than, HB624. My point there is saying that this is simple is not true. Your own body has its own varied definitions of sexes, which are self-contradictory. I have clients who would be a man in one and a woman in the other. And so that alone needs to be revisited. I would hope that you would deliberate more on what your definition is. It also is very different than President...
You've exceeded your time limit. Can you wrap up your comments? Thank you.
It's also very different than President Trump's definition of sex, which he has just put out in an executive order. And because we have that huge divergence between the federal definition, we're going to see very big differences in how these cases are handled.
Thank you for your time.
And one last thing, I have a report on this issue that I'm going to make available to your committee members as well on all of our research.
If you want to leave it on the desk with your witness form, we'll make sure that's distributed, or...
Yes.
Okay,
yes.
Thank you.
Thank you.
Any questions for the witness? See none, thank you. Next, to testify in opposition.
Yes, members of the committee, Madam Chair, my name is Dr. Susan Shelby, and I'm here to testify on behalf of my beautiful and talented daughter, Lavora Shelby, who is a transgender, who identifies as a transgender person. My career has been involved in medical research for the last 30 years, doing clinical trials, randomized clinical trials, and before that, identifying new medicines and spending 10 years in academic research at places like the Scripps Research Institute and the Salk Institute for Biological Trials. I'd like to let you know that I've heard many inaccuracies today, and I'd like to set the record straight. I'm not on any train, and I'm not listening to the train conductor. I trust the medical literature. That's what my training, education, and experience has taught me to do. The medical and scientific literature. And before I went to the Emerging Issues Committee last year and provided evidence about the roughly 2% of the population. That's a prevalence of 2% of the population.
Are you testifying, are you testifying in opposition to Senate Bill 76?
Yes.
Okay, can you keep your comments succinct to that issue?
Yes, thanks, I will. But I would like to address this because I hear a great misunderstanding. We are not a binary species. 2%, fully 2% of the human Homo sapiens species falls into a category of intersex, Klinefelters, Turner syndrome, 5-alpha reductase deficiency, and actually identifying as transgender. So it is completely unfair and wrong to say you are male or you are female.
Thank you.
And that you fit into those two categories. That is just simply an infactual medical basis.
You've exceeded your time limit, so we're going to go to questions. Do you have questions for the witness? Senator Moon?
Thank you for your testimony. You mentioned the intersex and some of the other anomalies. What is the percentage in our population that would make up those groups?
2%.
2%.
Prevalence,
Okay.
sir.
As I've listened to the testimony of those coming up, particularly on this bill, my mind goes back to some of the pastures that I oversee.
Some of the pastures?
Yes, ma'am.
Pastures of grass?
Yes, ma'am.
Okay.
And I've often wondered how rich I could be if I could develop an animal that could be a male one day and a female the other, but it's impossible.
Yes, it's called 5-alpha reductase
so what I'm trying to
deficiency.
say to you, ma'am, is that to a logically thinking...
It's doctor, sir.
Doctor, ma'am. To a logically thinking person, there are two sexes. There are male and female.
And that's incorrect.
Well, I beg to differ.
There are two.
I think
there are children that are born apparently female.
Can you you need to let him finish his comments and then you'll have a turn.
We're not, but there are, and for the purposes of this bill, I think there is male and female.
Do we
if you
let
look
him
all
finish?
If you look all across the different species of animals in particular, there are only one or the other.
2%.
There are
2% across species.
Ma'am.
So,
Doctor.
I'll just end it because I'm not going to get anywhere.
Let him
but
finish.
Thank you very much, Doctor. Thank you for your testimony.
Yeah, and if I can just go on to provide you with an example, Mr. Moon, if you look
Senator.
to the Senator Moon, if you look to the species of humans, if you look to other primate species, you'll find alpha 5 reductase deficiency, and that involves children who are apparently little girls who are born. They're well known in the Dominican Republic, actually, in a tribe that's well studied there, but they exist everywhere, actually. And those girls reach puberty and then grow a penis and grow testes and become boys. Now, do they have trouble there in the Dominican Republic with this? No. They are just known as the girls who become boys. We don't try to say you can't go to this bathroom. We don't try to discriminate and say you can't be hired at this job. They are just the girls, it's accepted. Those are just the girls that become boys. And I think the more that we, as adults who are sentient and attended college, can just accept that medical research shows for decades now that we are not a binary species, the better off we'll be.
Any other questions for this witness? Seeing none, thank you for your testimony. Next, in opposition. This will be the last one. Due to time. That was a question, so.
Hello. My name is Samantha Jones, and I'm a voter, a taxpayer, a Missourian, a public servant, and a state of Missouri employee. I'm also bisexual, and I am gender nonconforming. This particular bill, Senate Bill 76, causes my community and myself great distress. The language defining sex as only male or female on anatomical reproductive organs and chromosomal makeup is exclusionary, even though the bill seems to want to prevent discrimination and exclusion on the basis of sex. This definition permits discrimination of individuals who do not fall into these definitions, such as intersex individuals, and individuals whose reproductive organs may be different. Humans have a much wider range of anatomy and chromosomal makeup, as shown through biological scientific community, including XXY, XXX, and people with considered female genitalia and reproductive organs that can have an XY makeup because they didn't receive hormones that make the fetus change the organs to male in utero. There is ambiguous genitalia for all chromosome types, resulting in a sex assigned at birth that may not match the chromosomal makeup of the person in question, and these individuals deserve to be recognized and not be discriminated against as well. I am such a person. My uterus is too small, and I was able to access certain types of sterilization so that I do not die trying to have my reproductive organs work. The language of this bill suggests that I should be discriminated against and based on the definitions of sex and reproductive organs. This also suggests that every individual knows their genetic makeup, which is not generally done and is expensive to obtain. This bill suggests that individuals such as myself must disclose our private medical information to be on the receiving end of discrimination. More than anything, I want to live a life free of discrimination where I can live privately without my physical existence being legislated about on a regular basis. I've heard the senators of this committee speak about justice and freedom. If we do not allow for people to live with privacy and receive equality regardless of sex, we are infringing on their lives and doing them a disservice. Voting yes on this bill would allow for discrimination based on a rudimentary understanding of biology and ignore experts in the field and deny individuals privacy and autonomy.
Thank you. Thank you for your testimony. Any questions for the witness?
Thank you for being here. You know, as I continue to learn a lot more about this subject, and I thank you again for sharing your story. As we consider legislation the other day, I just want to iterate how important this hearing process is and whether you were able to come and testify or not. One of my colleagues the other day referred to a hearing as simply an airing of grievances. And as you all shared your stories and your powerful testimony and truly your expertise in this area, whether you were an attorney or a doctor or just somebody impacted by this legislation, I thank you for sharing those grievances with us and again having that understanding of how these laws will impact your very existence.
Thank you.
Thank you. Any other questions for the witness? Seeing none, thank you for your testimony. Leave your witness form there on the table. Senator Schnelting, do you have any closing comments? All right, thank you. With that, we adjourn health, families, and seniors. Thank you.